right mandible occupying mainly the right inferior border of the mandible. So these are the two things. It's going to be both soft tissue and hard tissue.
He had already had 3 or 4 surgeries done elsewhere over several years.
This is looking like a swelling because there's a pad inside.
Now know the hemangioma, the tumor is gone.
This is the fourth day after my surgery. The great change or makeover for my face.
Now moving on to still you see some existing deformity. Yet another case of hemangioma at Richardsons, and this time it is on the right mandible, occupying mainly the right inferior border of the mandible, starting from the chin and extending up to the ramus region. So this is the amount of tumor we plan to excise. It's going to be an external approach because there is no internal intraoral involvement, and also for the hemangioma we are going to excise this entire thing and suture it, but for the sculpting, the jaw sculpting, we are going to do some amount of osteoplasty at the lower border, because not only is the mass protruded, since it's occupying the lower border, his bone is also very much asymmetric, which can be appreciated on the scan. So these are the two things. It's going to be both soft tissue and hard tissue work. It's going to be a hemangioma excision with a bit of osteoplasty.
So immediately after we've completed the resection and reconstruction of this facial tumor. So what you're seeing here is before and after this large tumor removal. He had already had 3 or 4 surgeries done elsewhere over several years.
വായ് തുറക്ക്, കടിച്ചോ, പല്ല് കാണിച്ചോ, വായടച്ചോ. Yeah, looking very nice. It's just this, if it comes down, we can always do a Z and increase it later on. The commissioner, because that's the only thing, there's some sags, some cant is there. ഇത് നാളെ മറ്റന്നാൾ എടുക്കാം. ഫുൾ നോർമലായി ഉള്ളിൽ. ഈ ചരിവ് മാത്രമേ ഉണ്ടാവും, ബിക്കോസ് അവിടെ കുറേ ഇളുപ്പുണ്ട്. ആ ചരിവ് നമുക്കൊരു 6 മാസം കഴിഞ്ഞിട്ട് അത് റെഡിയാക്കാൻ പറ്റും. പക്ഷെ ഇനി തിരിച്ച് വരത്തില്ല. സ്വെല്ലിങ് കട്ടി കിട്ടി ഒന്നും വരത്തില്ല, ഫേസ് ക്ലിയർ ആവും. കണ്ണടച്ചോ, ഓക്കെ, ഇങ്ങനെ ചെയ്തോ, ഓക്കെ, ചിരിച്ചോ, വർക്കിംഗ്, എവറിത്തിങ് ഇസ് ഫൈൻ. വേദന ഉണ്ടാ, അത് ക്ലിയർ ആക്കി, പിന്നെ ഫുൾ ഫേസ് ക്ലിയർ ആക്കി, ചെയിനുള്ള പാരോട്ടിഡെല്ലാം എടുത്തു. Day 3 now, after we did a major hemangioma resection and reconstruction. Also did work on his bony part of the lower jaw. We did work on the soft tissue, hemangioma, everything. This is looking like a swelling because there's a pad inside. You're going to see this pad come off maybe after 2 more days. Do follow us in this video. We're going to take that up regularly. That was him before. Once you take this off, it's really going to be shrinking in. We've done all this compressing dressing because We don't want it to bleed. Come back?
Yeah.
When are you coming back?
Next Monday.
After 1 week.
Yeah.
5 days, 6.
How many days over today?
2 days, 4 days.
No, don't come next Monday. Come on Saturday. We'll remove everything. We won't send him with this Dynaplas for so long. Please sit down. We have a tape. Okay. We just have to put some, yeah, just ordinary dressing, not this kind of large one when it goes. Yeah, there's still some swelling, but you can put one Dynaplas like this, okay? Because this will go in then, like our small, just around the ear, this way. The rest are fine. Need this area. Open your mouth. Each other. Okay, fine. എല്ലാം സൂപ്പർ ആയിട്ട് വന്നിട്ടുണ്ട്. നമ്മൾ ആ കട്ടിയെല്ലാം എടുത്ത് മാറ്റി. ഓക്കെ, ഹിമാൻജിയോമ എല്ലാം ക്ലിയർ ആക്കി. നമുക്ക് ഫോട്ടോ ലിഖോ. So this is just 4 days now after we've done this major resection and reconstruction. You can see that. ഇതിനു മുമ്പ് എത്ര സർജറി ചെയ്തായിരുന്നു?
6 already done.
So 6 surgeries done before. This is the time we've been able to remove most of it for him. You can see the huge swelling. This is a very challenging case. We had to work on the skin, soft tissue, and also on the bone. And you can see that there is huge improvement. I wouldn't say it's 100% normal or perfect. That's because we've removed the tumor in toto right now. Now, this is the incision you can see from the ear. So I worked around the ear because he had a swelling there also. You can see there's a lot of scars he had. Everywhere scars, one running this way, another one going there. So one scar on that part of the ear, one behind the ear. All of that has been addressed. This is swelling. You can see it's just going down nicely. So that's one major part. Then we moved on to this aspect where you can see the scar from our surgery, the incision and closure. Now, yes, this part of the lip is got pulled a little bit. There's severe scarring and tightness of the skin. This is going to get better after a few months, and if it needs a little bit more procedure, we would be planning a Z on the corner to lift this part of the corner of the mouth up much later. But the tumor is gone. It's not going to have this back again ever, so that's a big relief. The histopathological report has not yet come. Innu vannittilla. Okay, hemangioma undavum. Iduvare alla hemangioma, പക്ഷേ ചിലപ്പോൾ hemangioma കൂടെ ഒരു lymphangioma അല്ലെങ്കിൽ ന്യൂറോഫൈബ്രോമ അല്ലെങ്കിൽ ഫൈബ്രോമാറ്റസ് ലീഷൻ അങ്ങനെ ഉണ്ടാവുക ബിക്കോസ് ബോണിൽ പ്രോബ്ലം ഉണ്ടായി. ഹിമാൻജിയോമ മാത്രം ഉണ്ടാകുമ്പോൾ കുറേ പേഷ്യൻസിന് ദേ ഡോണ്ട് ഹാവ് പ്രോബ്ലംസ് ഇൻ ദ ബോൺ ഞാൻ കട്ട് ചെയ്തെടുത്തു, ഇത്ര വലിയ പീസ് കട്ട് ചെയ്തു, ഇല്ലെങ്കിൽ ശരിയാകത്തില്ല. So that is why I told no, I will try to do the bone, but we could do it. Illegal, it was not becoming fine. It is not only soft tissue, it is showing wrong. Scan also bone is there, but I was not sure whether we'll be able to remove in one stage. But we removed it. So the diagnosis, let's see what it comes.
Okay.
All right. You take care.
When we come,
You'll know the report. Come by Saturday.
Okay.
Come by Saturday, not on Monday.
What time shall we reach here?
So come by 10 o'clock. Give us 2-3 hours. Don't be in a hurry on Saturday. If I'm not there also, no problem. Somebody will do the sutures, check you up and send you off. Today I've asked them to put one bandage here and some little bandage there. We'll give you 2 ointments. One ointment you apply outside, one ointment you apply. Then you don't need to apply anything inside. Only outside you can apply one ointment. You also. Pleasure. I think with time it will look even better.
Yes.
So there will be no big issue. I've majorly removed all of that dark color scar and dark color skin. That is a plan to do also. Because only removing that and that thing is sticking there.
In case it can be.
We will correct. Once it heals, don't worry. We will be able to improve that easily. Because now, no, the hemangioma, the tumor is gone. As a normal skin, no, we can handle it much easily to improve. All right.
So after 2 months,
2 months we can't do anything. 6 months you have to wait after this.
Yeah. Okay.
But first,
I want to go and join the police training.
you can join all that, do everything.
Okay.
If it can't come after 6 months, come after 1 year.
Okay.
Don't delay anything.
Okay, sir.
Okay.
Okay.
Right, bye.
Okay, thank you. Thanks a lot, sir. Yeah, my name is Joseph Lindo Clement. I'm coming from Kerala. This is the fourth day after my surgery. The great change or makeover for my face. 5 surgeries have been done in Kerala in major hospital, but not at I'm satisfied. Now here it's a well changed, and Dr. Sunil Richardson is a great human being. Have been changing lot of makeovers here, and I want to share my experience. It's a great pleasure for me, and it's a good satisfaction in my face. All of been saying that, and it's completely a makeover for me.
Can you say like how was your first surgeries? How did it go? Like were you happy with those surgeries before?
Yeah. Already 5 surgeries in Kerala. It's become little big, and it's not a completely changed. They have been step by step. They can remove these all things in one surgery. But here I come here. It's within one surgery have been done, and it's just a fourth day of the surgery. So it's a you can see this. It's a great makeover in my face. And thank you, Sunil Richardson, sir. It's a God's gift, I think.
So when did it all started? Like what?
Yeah, it's by the birth
And
time.
how did you feel when it started? And what was it happening, occurring in your mind
And here,
when it started?
it's become the seventh age. I've been started. We have been looking like this. I was sponsoring at the age of 7. After that, we have been discussed with some doctors. Have been done, and after that, the surgery done. It's become very big, and 5 surgeries done, and not that completely removed. After that, we came here. We have to see all the videos, and we have to check all the reviews and become satisfied. So we have to consult with the Dr. Sunil Richardson, sir. He said that he can surely do it in 90%, 100%. He said that he assured that he done it. It's very pressure for me. It's a very satisfied I am here.
How was your recovery phase? Like were you feeling any pain during your recovery?
No, I don't have any pain still here. No, no any other case have been well. 5 surgeries have been done in another hospital. That time there is a lot of pain after the surgery, but here I am completely normal. There is no problem in my face, no pain also.
How was sisters and doctors?
Yeah, all of them are great. It's like as a home. It's not been we consider it as a hospital. All of the facilities have been very good, and lot of patients have been very satisfied here. All of them have been treatment with other hospitals, and after that they have been done 5 more surgeries and then come here. Only within one surgery they have been getting good result here.
So what has doctor advised you right now? What is the follow-ups that has to be taken?
Yeah, I mean take some rest. It will reduce this bulge after 2 months, and it will be okay within 2-3 months.
Okay, thank you. All the very best.
Okay, thank you, Sunil Richardson, sir, and thank you this hospital and all the staffs. I'm very satisfied, and without God bless, thanks a lot.
Alright, so here is the 10-day follow-up following hemangioma excision, as we're calling it right now, because his MRI report was suggestive of a cavernous hemangioma. We are yet to receive the histopath report. So as you see, this is how he came to us, with a huge mass growing over the right hemimandible, right from the central part of this mandible till the preauricular region, and that's the extent of the tumor. It has considerably, the swelling has considerably come down. All the stitches have been removed except for the one last resorbable one. But apart from that, everything's healed well. He just has to apply ointments and he's good to go. Now, moving on to still you see some existing deformity. This lip is being pulled down, and that is mainly because the mass was around 7 centimeter in length and 4 centimeter in width, so much that we had to excite it in toto, and we are going to perform a lip lift after a few months to correct this deformity. But as far as the hemangioma is concerned, we do not expect a recurrence in his case. It could be hematomatous lesion too. We'll know that once the report is here. But otherwise, he's again good to go. No need for any dressing, just ointments, and he just needs to take some anti-inflammatories. And we will review him again after a month so that you can see how the swelling has settled down.